Which of the following pathologies is primarily responsible for the patient's pulmonary symptoms? 45-year-old man presents to PCP with progressive shortness of breath and chronic productive cough for the past year, so it's been an ongoing issue. Has a 20-pack-year smoking history. Physical exam shows wheezing, decreased breath sounds in both lungs. Chest x-ray shows hyperinflation and flattened diaphragms. Lab tests show low serum levels of alpha-1 antitrypsin. So which of the alpha-1 antitrypsin deficiency is a whole condition. Probably what we're having here. Anti-1 is showing it prevents proliferation. So he's having smooth muscle proliferation. So the smooth muscles of the alveolar is getting thicker, right? I'm thinking so alveolar wall destruction, bronchial smooth muscle hypertrophy, interstitial lung fibrosis, mucus gland hypertrophy, pulmonary artery hypertension. I'm thinking pulmonary artery hypertension. Smoking definitely affects there. It's not, the walls aren't being destroyed. Fibrosis is another top contender. Mucus gland hypertrophy. Yeah, I'm pretty sure I'm leaning more towards pulmonary artery hypertension.
Okay, final answer here.
Yeah.
Okay, let's talk about this actually. It's actually alveolar wall destruction, and I'll talk to you why, okay? So what is alpha-1 antitrypsin? What does this do?
I thought it prevents proliferation of the smooth muscle.
So this actually antitrypsin, you have to ask yourself, what is trypsin? It's like an enzyme, right? This enzyme, I think, deals with inflammation and kind of chomping down on the alveolar walls. So alpha-1 antitrypsin is to prevent that, right? So if you have low levels of this means trypsin, right, during inflammation, right? Let's see, chronic, your alveolar walls are going to be started to destroy, and it's going to lead to emphysema. Okay, that's how I remember at least, right? Trypsin is like an enzyme that breaks things down. So antitrypsin, right, protects the alveoli from being broken down. Also, on top of that, this enzyme is very, very important for the liver too. So these patients usually also get liver cirrhosis because the trypsin will also start breaking down your liver. Okay. So let's talk about pulmonary arterial hypertension. So pulmonary arterial hypertension, the one they usually test you on is like the primary version of it. Okay. The primary version of it is usually in females that are younger, right? And they have, lung kind of their lung is having arterial hypertension or high pressures because their smooth muscles, right, inside their lungs cannot relax. And so it's clamping down. So what's that's going to cause is something called cor pulmonale, right? And so they're going to have right-sided heart failure, but it's usually in a younger female, right? But pulmonary arterial hypertension, right, can be a complication of COPD. Do you understand kind of this sentence right here? If not, then I can kind of draw it out for you.
Yeah, I think I'm like reading it now, and I see where I went wrong in the logic there. That's just yeah, I see. So I was thinking emphysema, I said it, but I guess I was mislabeling what emphysema meant.
Yeah, emphysema is just, it's part of the obstructive pulmonary issues, right? So there's two types, right, of pulmonary issues that in your mind when you're going through questions or pathology, you should be thinking, is this restrictive or is this obstructive, right? And so you already know this patient has COPD and probably a little bit of chronic bronchitis too, which is in the obstructive realm. And then you add on top of that, right, alpha-1 antitrypsin, right, which is going to lead to emphysema, right? And so they're going to air trap like crazy. Then you have to ask yourself, why do they air trap and what happens when you air trap? The alveolar walls will start to dilate, and the diffusion barrier between the capillaries and the alveolus are not going to be as good. So that's why you're not able to breathe as well with emphysema or COPD or an obstructive issue. Okay. But pulmonary arterial hypertension happens because remember your lung tries to close off areas where it cannot get enough good oxygenation, right? And so kind of since we're on this topic, right? So here's your lungs. Okay, so the way I kind of say it is that let's say you have a how do I used to explain this in the easiest way? Um I can't remember what picture I used to draw, but so anyways, so you have these blood vessels, right?
Mm-hmm.
Your capillaries, right, and your pulmonary system, right? And so let's say one part of the lung is blocked off, your lung will then constrict that artery to shunt the blood somewhere else because it needs to be oxygenated somewhere else, correct?
Mm-hmm.
And so when you constrict a vessel, that increases the resistance. If that increases the resistance, right, you're going to increase pulmonary arterial hypertension, right? And over time, let's say if you have COPD or some kind of interstitial lung disease, whatever lung disease happens, right, you're not going to be able to perfuse as well. And so all the arteries are slightly constricted. So over time, if you don't fix that, your right side of the heart, you're right, here's my right ventricle, right, my heart diagram, right, your right side of the heart, right, is going to increase in pressure and over time fail, and that's called cor pulmonale, which is a primary lung issue that leads to right-sided heart failure. So does it make sense?
Yeah.
All right, perfect.